Hi everyone, and welcome to the MediByte channel. I'm so glad you're hanging out with me today. You know, as a healthcare professional, I see it all the time. When you're trying to conceive, hitting roadblocks is it's incredibly frustrating, right? It's confusing and it's emotionally exhausting. If you've been struggling to get pregnant, you're probably looking for some clear, straightforward medical answers. Well, today we're going to walk through a comprehensive explainer on one of the most common hurdles couples face: infertility problems tied directly to ovulation. I want you to know right off the bat, you are absolutely not alone in this. And really, understanding the biology of your own body, that's the very first step toward finding a solution.
So that brings us to the core question of our little consultation today. Why aren't you ovulating? It sounds like such a simple question, doesn't it? But man, the female reproductive system is incredibly complex. When you're tracking your cycle, timing everything perfectly, and you're still seeing those negative results month after month, it's just so easy to feel totally overwhelmed. But today, let's just pretend we're sitting together right here in the clinic. We're going to completely demystify this process, look at the science, and figure out exactly what might be throwing your cycle off.
Okay, let's dive into this. Here is our medical roadmap for today's explainer, so you know exactly where we're headed. First, understanding normal ovulation. Second, the causes of ovulation problems. Third, diagnosing those issues. And fourth, treatments and fertility medications. Let's get right to it.
Section 1. Understanding normal ovulation, the biological baseline.
So, by definition, ovulation is simply the release of an egg from the ovary, and this usually happens smack in the middle of your menstrual cycle. But biologically speaking, it is anything but simple. Honestly, it's like this incredibly fragile, delicate dance. For pregnancy to even have a chance of happening, a highly coordinated sequence has to take place. Specific hormones absolutely must be released from certain areas in your brain, specifically the hypothalamus and the pituitary gland, and they have to travel all the way to your ovaries in a very precise, typical monthly pattern. Your brain and your ovaries are basically in constant conversation. If that hormonal chatter is off even slightly, well, ovulation might not happen at all, or it could be wildly irregular.
And this brilliantly illustrates our baseline. A normal menstrual cycle occurs every 24 to 38 days. That right there gives you a fantastic, super quick self-check metric. If your periods are consistently falling outside of that 24 to 38 day window, or hey, if they're entirely missing, that is a strong clinical indicator that your body might be struggling to ovulate regularly.
But listen, if your cycle does fall outside that range, please don't panic. Ovulation issues are a remarkably common cause of infertility. We're talking 20% to 25% of all cases in women. To put that into perspective, up to 1 in 4 women experiencing infertility are dealing with this exact same thing. It's common, it's been thoroughly studied, and in a lot of cases, it's highly treatable. Moving on to Section 2, Causes of Ovulation Problems. Finding the culprit.
Now, what's really interesting about this slide is how it shows the stark contrast between two completely different ends of the spectrum when we're playing medical detective with missing or irregular periods. On one side, we have PCOS, or polycystic ovary syndrome. This is literally the single most common cause of chronic ovulation problems. It happens when the ovaries produce an excess of male hormones, which triggers irregular periods, weight gain, and sometimes acne. Now, on the complete opposite side, we have premature menopause. This one is actually pretty rare. Normally, the average age for menopause is around 51, but in premature menopause, a woman's egg supply drops way too low at a much younger age, which basically brings ovulation to a sudden halt.
But beyond PCOS and premature menopause, we always have to look at secondary and lifestyle causes. Remember how we talked about the brain earlier? Well, the hypothalamus and pituitary gland are exquisitely sensitive to even the tiniest shifts in your physical and mental health. Things like diabetes or thyroid imbalances, whether it's overactive or underactive, they can shut down ovulation entirely. And you really have to be gentle with yourself here, because things that might seem like totally unrelated lifestyle factors, like pushing too hard at the gym, sudden weight loss, or battling depression, these can be massive disruptors to your cycle. Even some everyday medications, like certain antidepressants, can actually interfere with those crucial hormonal pathways.
Let's move to and see how this builds into Section 3. Diagnosing ovulation issues, the investigation.
When diagnosing, we generally follow an escalation path, right? We start simple and then get more advanced. Step 1 is the absolute easiest. We just record your menstrual history. Honestly, just by looking at how often your periods show up and how long they last, doctors can usually get a pretty good idea if you're ovulating. Step 2, That puts the power right in your hands using home ovulation prediction kits. But if those don't give us a clear answer, we escalate to step 3, which involves clinical ultrasounds or specialized blood and urine tests. What we're actually hunting for clinically is a marked spike in your progesterone levels. That spike is the definitive, concrete proof that an egg was actually released.
Let's zoom in on step 2 for a second, because this is the most accurate method you can do yourself at home. These prediction kits are designed to detect a surge in luteinizing hormone, or LH, in your urine. That surge usually happens about 24 to 36 hours before ovulation, so it basically gives you a predictive window. But, and as a healthcare pro, I have to gently remind you of this, these kits are not 100% foolproof. Sometimes that hormonal surge is incredibly subtle, and it's super easy for an ovulation to just slip right past the test strip.
Which brings us to section 4, treatments and fertility medications, the action plan.
Okay, once we've nailed down a diagnosis, we get to the absolute most hopeful part of this whole process, the treatments. We actually have highly targeted medications specifically designed to kickstart ovulation. Let's break down the big 3. First up is clomiphene. It is highly effective and usually the go-to for women whose ovulation problems stem from PCOS. It's just a pill you take by mouth for 5 days right after your menstrual bleeding starts. Next is letrozole, which is an amazing option for general ovulation stimulation. But there is a massive requirement here. You absolutely must have a negative pregnancy test before starting letrozole, because taking it early in pregnancy can cause birth defects. And finally, we have human gonadotropins. These are really powerful hormones reserved for very specific fertility problems, and your doctor will select them very carefully based on what's going on under the hood.
So the crucial point is there's no one-size-fits-all magic pill here. Medical treatment depends entirely on identifying and then directly treating your specific underlying diagnosis. I mean, before we even try to stimulate ovulation, underlying issues like thyroid disease or having too much prolactin, those must be treated first. It's also super important to understand that meds like clomiphene and gonadotropins, they stimulate the eggs you already have. They can't magically create ovulation in cases like premature menopause, where the egg supply is simply too low. But listen, even if your eggs are depleted, there is still so much hope. Using donor eggs from another woman is a genuinely wonderful option that helps so many people build their families.
Medical science has advanced so incredibly much, giving us way more actionable interventions today than ever before. But it really begs the question, how well do you truly know your body's most fundamental rhythms? And what is your data telling you right now? Because once you're armed with this knowledge, you are fully equipped to have an empowered, productive conversation with your doctor. Thank you so much for joining me for this explainer today. If you found this medical breakdown helpful, please hit that like button, share this explainer with anyone who might need to hear it, and absolutely subscribe to the MediByte channel. We're right here to help you understand your health every single step of the way.